Good morning to all of you. Thank you to the panelists for such insightful conversation just now. A lot of you had a brief introduction to myself. So yes, my name is Shoaib Javed Hussain. I'm currently heading State Life. And I would agree with the lady that even I was confused who she was talking about. It went over my head too. Having said that, a lot of you over here would be wondering, what is a state-owned insurance company doing at a health tech summit? What does State Life have to do with health, medicine, and technology? To be honest, the short answer to that is everything. And the purpose of me coming out here today and talking to you about it was to give you a brief of what State Life is involved in, what we have been working at for the past 2 years, and what our vision is going forward. And the key important part over here is the vision that we are formulating cannot be delivered without the health professionals and institutions like yourselves. So, without further ado, at a glance, what is State Life doing? We are a life insurance company by tradition, with our original inception. However, we got involved in healthcare with the introduction of the social healthcare program, which some of you may know as the Sehat Sahulat program or the health card that the government is running. That was a good 10 years ago when it was piloted within Punjab, Faisalabad to be exact. However, now as we stand today, State Life's health coverage spans across the social health program that I just spoke about, corporate health coverage, individual family coverage, and also unique offerings such as women cancer protection, protection for specific communities such as farmers, freelancers, et al. Across this platform, today, State Life is covering, providing a service, healthcare service, a protection service, to more than 175 million Pakistanis. Now that is more than any population, more than population of most countries in the world. How many of you even knew of that? None. You've had a health conference, you've had the first day already. Did anybody highlight that? That the state-owned enterprise is involved in such a massive program and individually leading on it, administering it, running it? We're missing something here. Now, this 175 million growth that we saw, the expansion has come only in the past 2 years. Prior to that, the coverage, like I said, was on a pilot basis, small groups, so we were covering about 30 to 40 million population. To January 2022, it expanded on to Punjab, Islamabad, AJK, Gilgit-Baltistan. A month ago, we signed in with Balochistan as well. KP has been on it since before. We've got a Sindh Healthcare Commission CEO over here, he knows, and Saad Saab, hopefully Dr. Saab will be here soon. We've been in conversations with them about how to bring it across Sindh as well. So what we had was, 2 years ago, 2022, overnight, this program jumped from 30-odd million to 170 million. What that means is, over the past 2 years, we have administered more than 5 to 8 million admissions in hospitals. We have more than 1,000 hospitals across Pakistan impaneled under this program, impaneled under State Life's program, be it corporate or social. And these hospitals, not just big private hospitals, these are public hospitals as well, what you were referring to, and private hospitals. They're in big cities such as Karachi, Lahore, Peshawar, but also in towns such as Laya, Sibbi, D.I. Khan. They're everywhere, and there are more than 1,000 hospitals across Pakistan, from Gilgit to Gwadar, Karachi to Khyber, they're impaneled in this program. And would you believe that through the inception of this program, State Life has paid more than 225 billion rupees in claims to hospitals? That is a massive inflow into hospitals. That's a massive inflow into the healthcare system itself, and it is essential. We were talking about patient experience, which is exceptionally essential. It is very, very important. On our program, on the social program, we run an independent verification system through NADRA. We are linked in with NADRA. So when I talk about these 1,000 hospitals that are impaneled, at every hospital is a state life desk. When a patient comes in for the social health care program, they first go to the state life desk. State life registers them, verifies them with the NADRA real-time verification via NADRA that they are covered within this program. And so NADRA knows that a patient has come in and checked into the hospital. When they check out, third-party verification, no connection with us, NADRA calls the patient up. And they ask about the experience. State Life's handling of it, experience with the hospital itself, how they were treated, did they get all the facilities, the sahulat that they deserve or they were promised, and then their satisfaction. There's a questionnaire on the satisfaction. And it is a matter of pride that you've seen the numbers already, 125 million, more than 10 million admissions. That independent survey gives us a satisfaction ratio of more than 98%. Then more than 98 patients out of 100 come out saying that we were very satisfied, we were treated. And this is real. I've been there. I'm not a doctor, but you end up at hospitals and treating and all that. The experiences that these people share, you remember this, these are the most needy. These are people who never had access to healthcare. And they come out and say, Kiji, we were treated as if we came out of a Prado. Remember this. See, when I speak to my teams, the message is clear. If somebody is coming to our desk, it does not matter whether they walk out of a Jeep or a rickshaw. They're the same. And that's a message given to the teams. And what is heartening is when you are in different parts of the country, be it Balochistan or KP or Punjab, when you're talking to some of these individuals, the patients who are being treated, they come and say, we were treated as if we were VVIP. Now, some of you I see are not, maybe not from Pakistan. Those of you who are from Pakistan, you know exactly what that means. That even in largest of institutions and all of that, how people can be cut across. They can be told to go get to the back of the line. Or some certain privileged people can always jump the line. So for them to be saying, and dekhein, aapke in this hospital ke and the Rahman hospital ke CEOs are here. And it was one of the hospitals, National Hospital of Islamabad, personal experience. I met their owner, and he was ecstatic. He was over the moon. He was like, yeah, this thing that you guys are doing is amazing. And his reason was very simple. He went through a procedure, which costs about 10 lakhs or 15 lakh rupees. He had it done in his own hospital. And he said the best thing was that after the operation, after the procedure, the aftercare where he was rolled into, the person right next to him on the bed was getting the same treatment he got free of charge because he could not afford it. And he was ecstatic that his hospital is involved in such a great social program. It is something all of you, A, should be aware of, B, proud of. This is happening in today's Pakistan. This is happening in your Pakistan. Now, coming to the nitty-gritty of connecting to this conference itself, is when you are looking at a program which is so huge across the country, millions and millions of people being covered in it, there needs to be an infrastructure. As I told you just 2 years ago, it ballooned up, it grew exponentially. And as you can imagine, yes, we are a Sarkari Idara. So our first experience was a whole lot of paper files coming through, patient records for verification, for checking, and they came through, and overnight we were seeing record rooms being filled up. That, our record rooms didn't have space. Our Peshawar office was overwhelmed by patient data. And, I admit it, at one instance we walked in, and our team was like piling patient record in corridors. They're like, where do we put this? We don't have any space. And as you can imagine, same thing being experienced in other places of Pakistan. So we had to take action. Out of necessity, as they say, necessity is the mother of all inventions. So we had to take action. And what we did, first and foremost, is last year, July 22, we established a state-of-the-art data center in Islamabad. Its backup is here in Karachi. What it allows us to do is it provides us real-time data. Would you believe it? Anywhere in Pakistan, if a patient goes into one of State Life's impaneled hospitals, we get real-time data of which hospital, which district, through geolocation mapping, the patient has walked in. We have their diagnosis treatment coming through to us, their length of stay in the hospital, and when they get discharged, we also monitor readmissions. So first patient is discharged, how many times he's coming back for the same treatment because of the same ailment. So running this, so this is a data center that we put in, but of course, as you can imagine, running such a huge program with billions, hundreds of billions of cash flow coming in and out on a daily basis, what it means is we need financial control and transparency on ourselves, on the hospitals. We need this implemented. We need patient care management, which is essential in terms of the patient knowing the real experience, the human touch. The patient knowing that I have access, I have a means of communication. That's what patient care management means to us. Access to quality healthcare, and I will dig a little bit deeper into each one of these. Access to quality healthcare. We have developed a empanelment scoring system, a grading scoring system for hospitals themselves. So if a hospital wants to be part of this program, if a hospital wants the privilege to have access to 170 million Pakistanis and to care for them, they have to maintain a certain standard of quality. They cannot bully us. They have to ensure that their systems are good enough to treat Pakistanis and to be part of this program. And then it's not just them. We have controls on ourselves as well. We get ourselves audited, we get our systems audited, our procedures audited by a third-party audit firm. And then, of course, data management itself, which is the next step. We have the data, its management, and its use to proper health tech implementation has to come through, and we'll talk about that a little. So now cutting through into what it all means and what we are actually doing on this. So we talk about financial control and transparency. What it really is about is gatekeeping. Gatekeeping and ensuring there is no abuse of the system, not from within or without. We have real-time HMIS, as I told you. Real-time, we're getting data of admissions and exits, the diagnoses that are being put through. We have, like I said, we had paper records, we were overwhelmed. I just spoke about the patient record. The same thing comes through with the hospital records. Any hospital that is impaneled by us, we have a legal agreement with them, so whatever claims they can come through, all claims will be paid by State Life within 30 days. We aim for 15 to 20 days, but then that means a lot of information coming from hospitals themselves. So we are electronically connected with all of the 1,000 hospitals. No data from the hospital comes to us in paper form. And we've implemented this. We piloted this a year ago. Now we've fully implemented this for more than 6 months. What it means is that a hospital, for their claims, it comes through to us electronically. And we have, if you believe it, 4 layers of defense. Our first layer of defense against abuse and financial transparency, to ensure financial transparency, is our physical desk at the hospital itself, which means the patient coming in, we ensure that they are verified by NADRA right there and then on desk. It doesn't take more than a minute, so that they're admitted. There's a control. The physical presence ensures the procedures is being followed at the hospital as per protocol. Then behind, let's say, our back office, we've got 3 further layers of control. First is, of course, this is a healthcare program. We have doctors, specialists, which when the data comes through from the hospitals, the diagnosis and the treatments, we have cardio surgeons on our panels sitting in the back offices and other specialists. They verify that does this diagnosis and treatment, do they align? Then we have a risk management control team, which is your financial corporate professionals. They're looking at whether all the procedures, et cetera, have been correctly followed, from the medical treatment to the financial claims payment. And then lastly, real time, we get ourselves audited as well. There are auditors in there looking at the entire procedure, and once all three layers are met, then only is a claim payment made to the hospital. So that's our e-claim management system, and we were talking about tech and adoption of AI. We've got business intelligence tools implemented now. What that does is of course, now we are sitting on the largest patient data repository in Pakistan. We have more than 5 million patient data records within State Life now, across Pakistan. We are using that data we are applying artificial intelligence or business intelligence on that data as a control mechanism. What's basically is happening is, because we've got so much data now, that when a case comes through to us, you have the diagnosis and you have the prescribed treatment. Through AI, we're verifying is the treatment aligned with the diagnosis being set out. And this is important because 2 years ago, 3 years ago, we were seeing malpractice. We were seeing small cases, not a huge, but cases of abuse, where somebody came through a certain ailment or a pain, but because the payment for an amputation is higher, it was being diagnosed that we'll have to amputate the person's leg. Luckily, our controls were strong enough to stop such cases. So what this helps us to do is ensure something bizarre isn't happening. We're not saying we're doctors. We're not taking the place of a specialist, but it makes sure there is no abuse of the system. And that's where your AI-based screening of claims comes in as well. And of course, like I said, it's not only the information that comes through to us that is digital. The claims that we pay to the hospitals are also digitally transferred, so there is no money transfer, cash transfer, or by hand transfer. It kicks out the middle person, so it's directly into system, so there is no chance of any issues coming through. That any individual, even in our system, can blackmail a hospital or provide any sort of malpractice when it comes to claim payments. The hospitals know their payments will be paid to them digitally. There's no middleman in the person. They don't need to satisfy anybody. And us Pakistanis know what I mean by that. And they can be free of that. And that is very important. Patient monitoring system, like I said, I think Dr. Farhat Abbas very correctly pointed out, the human touch is very important. Patients need to know that they're cared for. When the patient is coming to a hospital or speaking to a doctor, they're at their most vulnerable. And that human element cannot be replaced by technology. Completely agree. And I think it is correct. It's a matter of pride. Dr. Farhat Abbas introduced himself to me today, and I said, sir, I've been hearing you're a household name in Pakistan. We've been hearing of you since we were children. Not that he's old or I'm that young, but the point being, that's the beauty of Pakistan's healthcare system. Even despite all the challenges that we have, and we know we have challenges, but we have great professionals. They become household names because of the care they provide. Because you, as the healthcare professionals, reach out, you understand the vulnerability that a family or an individual is facing, and you touch them on that human element. So thank you for that. But it is important that when we talk about tech, we don't replace that. And that's where patient care management comes in. With this, of course, the whole idea is on-ground feedback. So I told you we've got an on-ground team at every hospital, HMOs and DMOs. Their purpose is to be checking in with the patient, ensure that the protocol is being followed, that they're being taken care of. It allows the patient to give us feedback, real time, on ground, whether we are doing a good enough job or not. They can tell us we're not satisfied. And they have channels open to us. They have 24/7 call centers that we've set up, that they're aware of. Every desk has that number written out. So if they're not happy with something, or even if the patient's family is not happy with something, all they have to do is call that number. It's 24/7 attended. And we'll address their issues, we'll go back to them. And even more importantly, it's about information on their fingertips. So we've got data apps, we've got applications where if somebody is part of the State Life Health program, they can go onto that data, they can see which hospitals are closest to them, and also which hospital specializes in what treatment. So they know which ones to reach out to, which ones to go to. So all of that is available to them in the palm of their hand. When we come to access to quality healthcare, like I said, this is a bit of a check where we're ensuring we've actually put in effectively information about the hospitals themselves out. So like I said, on the data app and on our website, a patient or a policyholder or a customer can go and check which hospital will provide which services, and all the information is there. But also we've created basically a grading system. So to be part of this empanelment system, there are criteria that a hospital needs to meet. From emergency services, what sort of ICUs and ICUs they have, the wards, number of beds, the OTs, pharmacy services, lab, radiology, all of that. Based on that, there's a criteria that a hospital must meet. Based on that, we've set up a grading system, A+, A-, B+, B-. And it is effectively a positive incentive. Yes, we are coming from a corporate perspective, so it is kind of like a KPI that is being set out. The better your services, the better your quality, the higher tariff you get. So of course, something like Aga Khan is right up there. We appreciate that, or in this hospital, we appreciate that. And we want our medical fraternity to come up to that standard. So we give a positive incentive to all other hospitals. That if you want for us to include you in the same tariff as Aga Khan, bring yourself up. And we do that. And there's a grading system that follows each year. We review this. It's not that once you're in panel, that's done. It's reviewed and audited each year. Should you slip, either you go down on that tariff or you're de-empaneled, you're kicked out. And when we kick them out, we don't just kick them out. It is with a review form. We tell them, here are the reasons. This is why you are not to be empaneled, or you're being de-empaneled. You have to address this. I improve your OTs, or the number of beds, or the service you're providing. This is the issue we found with you. You improve this, then our team will come and survey you again, and should we see that you fixed the problem, then you can be part of this. Because what the message that we really want to give, it's a privilege to have access to 175 million Pakistanis, and it's a privilege to be able to service them. It's a privilege for us, and as it should be for the healthcare system as well. So that's what we've set in, and of course, in all of this, transparency for the hospitals is also important. We give them visual evidences. We give them the scoring of service providers. They've talked through the entire process in the system, so they know what they're getting into and what standards they need to that they need to adhere to, and based on that is obviously the rates and the tariffs that I spoke about. And then, of course, like I said, one of the key important aspects on this is that third-party review. Yeah, is this working? Yeah, there you go. Technology right there. Is the third-party audit review. That, continuously we are getting ourselves audited as well as the hospitals, so that there is a third-party check on us, which is independent, and hence, even if a hospital comes and complains about it, we can say that it's not us. This is a third-party verification on the whole process. And then, of course, lastly, on this aspect is data management. Now, what we are doing, this is the next step. Now, what we are doing with the data management is the real-time data that I spoke to you about, is we are getting disease surveillance across Pakistan. The data that is coming across to us, it is categorized, it is sifted through effectively. We have data by district, we have data by disease. So if we say we have more than 10 million admissions, we have more than 10 million records of the ailment, the disease, the diagnosis, and which district or sector of Pakistan that came about in. The patient themselves are geolocated, so we know where they've gone. And that's creating electronic medical records for us. Right now, we're sitting on more than 5 million individual data medical records. That is the largest medical data repository, electronic data medical repository in Pakistan. And hence my question to you very first up, did anybody mention state life? We're missing something. And all that does is we want to go to the next step. and all of you would agree with it, preventive care, better OPT, better informed OPT, more informed diagnosis, that can help reduce the cost of healthcare across Pakistan. It can ensure our resources are better channeled. It can ensure our buck goes a longer way. And of course, more efficient and timely care to the patients that are coming in. And that's the next step that we're talking about over here. Spoke about the electronic medical records. The augmented preventive care. I think Salim Saas bhi baat ho rahi thi pehle. And preventive care is really where we need to focus on, because that's what brings down the health costs across the country. That's what ensures a healthy population. If a person is admitted into a hospital, it's already too late. And that's what we need to understand. I'm sure all of you do. That is not the solution. The solution is the admissions don't happen. The healthy lifestyle is adopted. And this is where healthcare system and insurance company comes together. Even financially speaking, it's in our interest. The people are healthier, happier, and that they live longer. So if we want a healthier population across Pakistan, we need to ensure preventive care and disease preventive steps are being taken. And this is where we think the data that we've collected is essential. That we know, for example, in DI Khan, there is, for some reason, a concentration of kidney stone issues. Something to do with the diet? I don't know, you guys would know more. We know in which areas of Punjab there is greater cardiovascular issues. So when it comes to preventive care, we can target it. It can be through health awareness. We know which areas there are cancer issues. Oncology rates are very high. We can target creating awareness around those areas. We're talking about big diseases such as cancer, such as hepatitis C. Pakistan is suffering from hepatitis C. Cancer rates in women in Pakistan are the highest in Asia. It's a massive concern, which is why at the very start I said we've created specific products such as women cancer protection and HRI protection and all. But we can do that now. We have a foundation, and of course improve patient experience at the end of it all. How does it improve patient experience? It's very simple. You take Karachi as an example. Aga Khan is a premier hospital. Some of us are privileged enough to have access to it. We come there, we can bring our family members here. However, once a procedure, something has happened in Islam, at Aga Khan, and say a complication or an emergency hits, for most of us it's still more than an hour away, especially it's rush hour. It's not ideal to try and rush to Aga Khan. Most of you would feel that in your daily commute. So you'll opt to go to a nearer hospital, maybe Ziauddin or South City, whichever it may be. And then it's an emergency situation where you're starting from ground zero. That hospital has no data record of the patient. They don't know what procedure was carried out a week ago or a month ago, or the complications. And in that situation, expecting the family to deal out all the information is not easy, because they're stressed themselves. And of course, the medical professionals out there, for them it's not easy. So integrating hospitals with the health information, at least basic patient data information, which brings about the history of the patient on record for the doctor, I'm sure they'll be able to treat them better, is essential. What it also can do is, when we talk about preventive care, it can bring down the healthcare costs for us, because if only 5 days ago or 2 days ago some basic labs were done, they don't need to be repeated. Because right now, if you end up at a different hospital at an emergency sector, your entire investigations start from scratch all over again. That is money. Money for and listen, you guys would know it, I know it, I've seen it. Healthcare in Pakistan means people selling their houses, selling their family land to afford healthcare for a family member. So when these costs pile on, for a lot of Pakistanis, it's pushing the entire family below poverty as well. We have seen that. When we say that, hey, let's go get investigations all over again, there is an entire system around it. We've seen it. Families break down. Old grandfathers are trying to get their granddaughters treated. They've made the trek from Chitral to Islamabad. That trek itself cost $10.50 for them. And then for them to get involved in tests and over again, it's money they don't have. They borrow, and they get sucked into the lending system, and something that the families then suffer for generations. So treating that improved patient experience is not just about the human. Yes, it is very important to get the human element in. And what's even more important is to make healthcare accessible and affordable for all Pakistanis. Lastly, what I would say is this, that what we are doing here at State Life and with provincial and federal governments and some corporations out there, and some new tech companies, startups that are also coming in, is this something unique. Within State Life today, we have obviously health professionals, we have IT professionals working together, we have doctors and actuaries sitting in the same room providing a service. This is not only unique for Pakistan, believe me, I'm an actuary who's worked across the world, this is unique for the world. The systems that we have implemented in State Life, I'm talking about the tech digital transformation that has happened in State Life over the past 2 years. I was in Berlin a week ago. It was a state visit on the healthcare side, because they do universal health insurance for everybody. I was astonished to find out our digitalization is better than what is available in Germany across hospitals. They are still carrying paper records of patients from one hospital to another. In Germany, you have a population of 70 million being covered under the government program. In Pakistan, it's more than 175 million. They have 100 insurance companies servicing that healthcare system of 70 million. In Pakistan, you have one insurance company servicing 175 million. So now where we are at is a call to action. We cannot do this on our own. You all are the experts. We have done something fantastic and phenomenal, which I am proud of, in a short time period of 1.5 to 2 years. We are sitting on electronic data. We have that categorized and sifted. We have connected, 1,000 hospitals are digitally connected with us, which means they can be connected with each other as well, which is exactly what you all have been talking about. I'm sure that's what you spoke about yesterday too. The solution is here with you. The solution is here with us to work together and enhance it further. And that would be my last thing, that's a call of action to all of you. Come speak to us. We want to be tired, we want to be exhausted here at State Life, because we believe this is a service for all Pakistanis, and we are at a moment to genuinely serve Pakistan across all strata of society, and I look forward to hearing back from you all. Thank you very much.